If you've ever thought your oral health only impacts your teeth, think again. In this episode of The Diary of a CEO, Dr. Victoria Samson, known as the Saliva Queen, shares groundbreaking research connecting oral health to major conditions such as heart disease and infertility. The state of your oral microbiome could be a stronger indicator of overall health than you realize. Dr. Samson explains why caring for your mouth could be crucial to preventing some of the world's most serious diseases. Here are 5 action items from this episode. Elevate your oral hygiene routine. Regular brushing and flossing do more than protect your teeth. They help prevent systemic health issues like heart disease and diabetes. Reduce sugar and manage stress. Keep sugar consumption low and find ways to manage stress effectively to maintain a balanced oral microbiome. Rethink your mouthwash. Steer clear of alcohol-based mouthwashes that can disrupt healthy oral bacteria. Choose products that support your microbiome. Monitor your health with saliva tests. Explore oral microbiome testing as a proactive way to detect early signs of health problems. Act quickly on gum disease. Address bleeding gums and other symptoms immediately as they could signal larger health issues, including fertility challenges and increased cancer risks. In this episode, Dr. Victoria Samson, known as the Saliva Queen, highlights the critical link between oral health and overall body health, uncovering connections that extend far beyond what most people, even many dental professionals, typically consider. Samson's research emphasizes that an imbalanced oral microbiome, a community of approximately 700 types of bacteria amounting to 2 billion total organisms in the mouth, can lead to systemic health issues. These range from common conditions like gum disease and tooth decay to severe and surprising links to infertility, heart disease, Alzheimer's, diabetes, and even cancer. One notable finding she shares is the impact on fertility. Over 90% of men facing fertility issues were found to have oral disease, and women with gum disease took longer to conceive. Addressing these oral health issues led to significant improvements, with a 70% rise in successful pregnancies among treated cases. Additionally, men with gum disease were shown to be nearly 3 times more likely to experience erectile dysfunction. Samson details how the oral microbiome's influence extends through daily activities like breathing, eating, and kissing, which affect its balance and can result in bacteria moving from the mouth to other parts of the body. This migration can trigger or exacerbate inflammation, a core factor in many chronic diseases. The conversation touches on groundbreaking research conducted during the COVID-19 pandemic, which found that patients with gum disease were 9 times more likely to face severe complications from the virus. The underlying cause was identified as a dual impact: inflammation from gum disease combined with bacterial infections leading to critical conditions like pneumonia. This research, published in the British Dental Journal, gained recognition from global health authorities and influenced decisions to prioritize dental care during health crises. Samson's career trajectory, from traditional dental training to focusing on the oral body health connection, saw a significant shift with her work on saliva-based diagnostics. She developed one of Europe's first comprehensive oral microbiome tests, highlighting saliva as a crucial and underutilized diagnostic tool for understanding systemic health. The push to integrate saliva testing into routine health checks stems from her belief that it can offer insights similar to blood tests, but more accessible and tailored to detecting early signs of various diseases. The episode concludes by emphasizing actionable steps for improving oral health and, by extension, overall well-being. Samson addresses common oral hygiene questions and myths, covering topics like the timing and technique of brushing, the effects of dietary choices, and the real benefits or drawbacks of products such as mouthwash and chewing gum. Through her insights, listeners are encouraged to rethink their approach to oral health, viewing it not just as dental care but as a fundamental component of holistic health management.